Peace and welcome in to the DMS. This is a safe space where I inspire and educate my community and by extension, the world. We are in an age where we have to put intention behind our physical and mental health. When medical intervention is needed, you and your life experiences are the keys for your healthcare team to provide life-saving measures. No one knows your body better than you. Healthcare is not one size fits all. Our genetic makeup varies too greatly. For instance, delving into the neurological disorder of epilepsy, the way it presents in people's lives is so diverse. Epilepsy is characterized by recurrent seizures, although not all seizures are epilepsy. Some seizures can be caused by factors such as high fever, head injury, drug use, and other medical conditions. The stigma associated with epilepsy can lead to social distancing and discrimination. Intentionally aiming to make someone feel bad about their medical condition is being willfully ignorant. Be above this behavior. Think of your brain as a tool for your mind, the conscious and the subconscious. They are all connected through electrical impulse. With proper treatment and management, many people can go on to lead normal lives while dealing with epilepsy. Epilepsy can develop at any age, but will commonly present itself during childhood when our brain is experiencing profound growth. When we are 60 and above, this is also a time our brains go through a drastic shift. Seizures occur due to abnormal electrical activity in the brain. The brain consists of billions of neurons that communicate through electrical impulses. What characterizes a seizure are those same electrical impulses that become disrupted, leading to a surge of rapid-fire activity spreading across the brain. There are two main categories of seizure types, generalized and focal. With generalized seizure types, these can affect both sides of the brain and can result in loss of consciousness. Absence seizures, previously known as petit mal seizures, typically occur in children. Symptoms include staring into space with or without subtle body movements. Movements may also include eye blinking or lip smacking and only lasting 5 to 10 seconds. These seizures may also occur in clusters, happening as often as 100 times a day, and cause a brief loss of awareness. Tonic seizures cause stiff muscles and may affect consciousness. These seizures usually affect muscles in the back, arms, and legs, and may cause the person to fall to the ground. Atonic seizures, also known as drop seizures, cause a loss of muscle control. This usually affects the legs. It often causes sudden falls to the ground. Clonic seizures are associated with repeated or rhythmic jerking muscle movements. These seizures usually affect the neck, face, and arms. Myoclonic seizures usually appear as sudden brief jerks or twitches and usually affect the upper body, arms, and legs. Tonic-clonic seizures are known previously as grand mal seizures. These are the most dramatic type of epileptic seizure. They can cause a sudden loss of consciousness, body stiffening, twitching, and shaking. They sometimes cause a loss of bladder control or biting of the tongue. When seizures appear to occur in one area of the brain, they are characterized as focal seizures. Symptoms of focal seizures may be confused with other neurological conditions, such as migraine, narcolepsy, or mental illness. A thorough exam and testing are needed to tell if symptoms are the results of epilepsy or another condition. Focal seizures without the loss of consciousness were once called simple partial seizures. They may alter emotions or change the way things look, smell, feel, taste, or sound. Some people experience deja vu. This type of seizure also may result in involuntary jerking of a body part, such as an arm or a leg. Also, focal seizures may cause sensory symptoms such as tingling, dizziness, and flashing lights. Focal seizures with impaired awareness were once called complex partial seizures. These seizures involve a change or loss of consciousness. This type of seizure may seem like being in a dream. During a focal seizure with impaired awareness, people may stare into space and not respond in a typical way to the environment they're in. They also may perform repetitive movements such as hand rubbing, chewing, swallowing, or even walking in circles. Focal seizures may come from any lobe of the brain. So here are some areas they can originate in and what they control in the body. For instance, temporal lobe seizures begin in the areas of the brain called the temporal lobe. The temporal lobes process emotions and play a role in short-term memory. People who have seizures in this area often experience an aura. Usually seizures are an unexpected event and can happen at any time. People who experience auras can be alerted when one may occur. The aura may include sudden emotions such as fear or joy. It also may be a sudden taste or smell. Or an aura may be a feeling of deja vu or a rising sensation in the stomach. After all, our stomach is our second brain. Our intuition can rise from our gut. If you have that gut feeling, trust it. Your body is trying to protect you in many ways than you know. During a temporal lobe seizure, people may lose awareness of their surroundings. They also may stare into space, smack their lips, swallow or chew repeatedly when nothing's even in their mouth, or have repeated movements with their fingers. Frontal lobe seizures begin in the front of the brain. This is the part of the brain that controls movement. Frontal lobe seizures can cause people to move their heads and eyes to one side. They won't respond when spoken to, but they may scream or laugh unprovoked. They might extend one arm while the other is flexing. They also might make repetitive movements such as rocking or bicycle pedaling. Occipital lobe seizures, as you guessed it, occur in the occipital lobe of the brain. This lobe affects vision and how people see. People who have seizures that begin in the occipital lobe may have hallucinations, seeing things that aren't there, or they may lose some or all of their vision during the seizure. These seizures may also cause eye blinking or make the eyes move erratically. Now, whether you've been recently diagnosed or you've been living with your seizures for years, you have the power to generate some positive electrical impulses right now. Speaking positive affirmations strengthens neural pathways and activates the reward centers in the brain. Positive affirmations are powerful tools that can reprogram our minds and the way we see the world. They actively fight those depressive thoughts and voices that keep us in a low vibration, and all you have to do is speak it. Here are some affirmations that you can repeat with me daily. I am stronger than epilepsy. My seizures do not define me. I am deserving of love and understanding. I am resilient in the face of challenges. I trust my body's ability to heal. My well-being is a priority. I have the strength to face my fears. I choose to focus on what I can control. I am empowered to advocate for myself. I am more than just my diagnosis. I accept myself unconditionally. I am mindful of my triggers and take steps to manage them. I am open to receiving support and guidance. I am proactive about my health and well-being. I believe in my ability to overcome challenges. I am surrounded by love and positivity. I embrace my unique journey on this planet. I am more than capable of finding peace within. I embrace each day with optimism and hope. I am deserving of respect and dignity. I am in control of my reactions and responses. I am compassionate towards myself and others. I am deserving of peace and tranquility. I am in tune with my body's needs. I am resilient in the face of uncertainty. I am empowered to live my life on my own terms. Speaking powerful words like this may be a complete paradigm shift for most people. Some of us are accustomed and raised to speak negatively about ourselves and people around us. Luckily, there are those of us that recognize this cycle of trauma, and we are doing something about it. We no longer have to die to reach heaven. We can create a blissful, healthy, and balanced existence within ourselves right now. Once we have done that, that energy will spread to those around us. One may need to seek professional medical intervention if any of the following occurs. If your seizures last more than 5 minutes, your breathing or consciousness doesn't return after the seizure stops, you have a second seizure that follows immediately after the first, you have a high fever, if you're pregnant, if you have diabetes, if you injure yourself during a seizure, or if you continue to have seizures even though you've been taking your seizure medication. If this is the first time ever having a seizure, seek medical advice. The diagnosis of seizures involves a thorough medical history, physical examination, and diagnostic tests. These tests include, but not limited to, blood tests, an EEG or electroencephalogram, and an MRI or a magnetic resonance imaging. Your healthcare team will provide treatment based on underlying causes, type of seizure, and your individual factors. Famous management options for seizures are anti-epileptic drugs, lifestyle modifications, and surgery. Please do your research on any pharmaceutical drugs you're thinking of taking. Living with seizures can come with a variety of complications that require modifications to your daily life. Having seizures at certain times can be fatally dangerous to yourself and those around you. Having epilepsy, you are at risk of unexpected falling that could lead to head injury or broken bones. People with epilepsy are at a higher risk of drowning while swimming or bathing due to unexpected loss of body control. If your seizures cause you to either lose consciousness or bodily control while you're driving, obviously this could cause an accident. Wearing a medical bracelet and having a seizure plan can be very beneficial if one were to ever occur in public. Seeking support from healthcare professionals, counselors, and various support groups can help manage psychological, emotional, and social aspects of living with seizures. Regular medical follow-up is essential to monitor seizure control and to adjust medications if necessary. There may also be questions or concerns you need addressed by your doctor. Educating oneself and others about seizures can help reduce stigma and promote understanding. It is essential to inform family members, friends, teachers, and coworkers about your condition and provide guidance on how to respond during a seizure. Please note that this is general information on seizures and no substitute for professional medical advice. If you or someone you know is experiencing seizures or related symptoms, it is imperative that you consult a healthcare provider. It can take time to be open about your medical information, but there are some people who will listen and wouldn't mind helping if the need arises. Be safe, and most importantly, take care of yourself.